Hi, Lyndsay.
Hello.
Okay. So we're typing about and talking about here a big series that Lyndsay is doing on the crisis in women's reproductive health in Nova Scotia. And the series launched this week with a look at painful conditions of the uterus, uterine conditions in the lingo, like endometriosis. So Lyndsay published that story on Tuesday, and you can read it now. Not right now. Stay here live. If you're joining live, stay here live. If you're watching this on later, when it's not live, you can pause and go read at thecoast.ca/endo. That's just ENDO, like endometriosis. So Lyndsay's typing, and we just want to get this set up. But people are joining, so this is good. I'm going to give an actual IRL wave back to some folks. So what we're going to do here, Lyndsay and I will chat for a few minutes, and I've got an iPad right beside me. So we'll chat about the story and about endometriosis and about the crisis in Nova Scotia. How's it looking?
Looks good. Pin.
Right on. Okay. Perfect. Okay. So yeah, we're going to chat for a few minutes. Hopefully not too long. I think there's definitely going to be questions from people watching, and we definitely want to take your questions. So we'll chat for as little as possible, and then we'll start taking some questions. We don't want this to drag on forever, but we may run out of questions. That'd be exciting actually if we did. Anyway, hi Lizzy, how you doing?
Hello, I'm good. I'm doing well. This is exciting.
Yeah, it is exciting. It's an exciting topic. It's a bad topic, but it's exciting to be able to do something about it. It feels.
Yes, it's exciting to tap into a topic when you know so many people are affected by it, and it's getting that kind of reception because so many people are affected by access to gynecological health here.
Yeah. So, you're the Coast news reporter. You've been with us for about 6 months, and you've got you're a news reporter. You cover lots of news stories, but you've got a particular interest in health journalism.
Yes, absolutely. So I've been covering mostly COVID, a lot of restrictions and pandemic news, but as much as possible getting into our hospital staffing, doctor numbers, everything like that, how health is managed in Nova Scotia.
Okay, so yeah, from COVID, we've got now this series on women's health, and particularly this week's story about endometriosis. Which is a big issue for women. And well, I mean, it's women, it's trans men, it's some non-binary people, anybody who has a uterus, which is basically half the population of Nova Scotia. So it's a big deal for that half and the other half, like me. What is endometriosis?
Well, endometriosis, it affects 1 in 10 Canadians with uteruses, and it's a very painful condition for most people that is all about misplaced tissue developing where it's not supposed to, and that causes scarring, fertility issues, chronic pain. It's often associated with an individual's period, but not necessarily. And it's a really hard to diagnose. It's a very misunderstood condition, and that's something that a lot of people who spoke to me for this story are suffering with, either likely have it and are struggling to get a diagnosis, or definitely have it and are struggling to get the surgery, the treatment, the adequate sort of care they need to keep their lives moving.
Okay, so 1 in 10 in Nova Scotia, that'd be like 50,000 people.
A lot of people.
Wow. Okay, so it's a big deal. And is it talked about a lot?
I would say no. What really came up in this reporting experience was just finding out how many people have been suffering largely silently with this chronic condition, and it's not very often talked about. I think there's a sort of understanding that when pain or conditions are tied to things like our period, or they're not talked about, there's a bit more shame. There's a little there's sort of concern about bringing it up, and I think that it sort of translates into how it's often harder to care for than some other conditions.
Okay, gotcha. So it's a big deal. It's not talked about much. Perfect, Coast story. So let's get into the specifics of how this story happened and why we're talking to you. You know what's weird? After doing so much zooming, to see the other person, you look at the camera, and for you and me to be here in the office,
it's a little funny
It's a little weird. I mean, people are only going to get us in profile. So if I look at the camera to talk to our readers, don't take offense, okay?
Of course not.
Because I can see you too, so like at the barber. Okay. Anyway, for people who don't know, which is of course most people, here at the Coast, behind the scenes at the Coast, most people have not been here. We're coming from the Coast office in downtown Halifax. These are old Coast newspapers, but of course, most of what we do now is online, including this story, thecoast.ca/endo. Anyway, for people who don't know much about the Coast, we have a really small newsroom, and there's way more stuff going on than we can keep up with. So you wouldn't have to do much work to have stuff to cover, because there's just so much to cover. But then, on top of the regular, that sort of news cycle, as your editor, I do try to give you freedom to explore things that you find interesting and curious, in hopes that you're going to stumble across something that no one else is looking at, that our folks here are going to find interesting and curious. And to me, that's the best Coast story, something that no one else is talking about that we find. So, and you did that here. You did that in this situation. So I want to hear remind me how this happened, because it seems to me one day, I can't remember if it was on a Zoom call or it was in the office, just all of a sudden one day, you were excited about this story.
Yeah, it definitely started off a lot smaller because I care a lot about health, and I'm talking to people I know in Halifax and Nova Scotia about what they're experiencing navigating the health system. I like to chat with the nurse I see if I'm at the walk-in, my own doctor, and something that sort of started percolating just with a couple people, an individual who was dealing with endo, and then a nurse, was that it seemed to be becoming clear that access to seeing an OBGYN was really, really hard, that people were waiting a really long time to get their appointments to actually see these specialists, and that was sort of a problem among a few people who had chatted with me. And so it was at that point that I sort of thought, okay, this is an interesting health story that we can dig into, and I was really hoping to find out about the wait times and really what this waiting was like for people.
Yeah, so maybe to tell these people you're talking to, how long it might take them.
Yeah.
But, this story is bigger than that. Something changed as you were digging into this.
Yeah, and I think it has a lot to do with, like we said at the top, that things like uterine conditions just aren't very often talked about. So when I put out just a very simple call out for source tweet, I got more responses than I really would have respected. Messages on my personal Instagram, Twitter, email, phone calls. So many people were reaching out to me, and it became really clear that, oh my gosh, I'm not going to be able to interview, the 50 plus people who've reached out just in the last little bit. So I created a survey that I hoped would really capture a detailed experience of what the process was like, find out about their wait times, their pain, and sort of go from there. And so it was in this call out that I realized, oh my gosh, so many people are waiting for OBGYNs or are struggling in this process. They're feeling alone. They're feeling like they don't really know what's coming next. And it just turned out to be something that was so much bigger than, a couple people are struggling with this.
Whoa, so yeah, when that became a survey, you're doing borderline science here, putting a call out.
Yeah, it did feel really research heavy in that sense, definitely.
Okay, so this story grew like bonkers. Is it exciting when that happens, or is it scary?
I think a little bit of both. It was definitely very, it's good to know when you're working on something that people are really experiencing this, that this isn't just something small, that this is something that's really serious. But it also meant that it was going to have to be so much bigger. I would have pitched you one story,
right,
a one-off about getting access to an OBGYN, and now we're here and we're launching into this series. There's going to be multiple features about the different pieces of all of this, just because it has become such a big topic, and there are so many Haligonians who've been really generous with me and sharing their experiences, their time, their stories, and I think it's become bigger.
Okay. You can do a little station break here, like a TV person. If you're watching live and you just joined us, I'm Coast Editor Kyle Shaw. I'm with Coast reporter Lyndsay Armstrong, and we're talking about Lyndsay's series on the crisis in gynecological healthcare in Nova Scotia. series launched this week with a look mostly at endometriosis. And so to read it, you can go to thecoast.ca/endo, ENDO for endometriosis. Okay, so you're talking about the series. At this point, what are we looking at? So obviously things change, right? We've just gone over how things change and grow, but this second, we're looking at a 4-parter?
Yeah, a 4-parter, and the next piece of this puzzle to me is fertility. It's something that a lot of people in the initial call out shared with me, and it's something where long wait times are affecting people's access to being able to grow their families. It's a big financial drain for a lot of people, and so moving into that next, and then the component that I think is so tied to all of these stories is the mental health aspect, and how much people's mental health is impacted by accessing this type of care, how things like long delays and chronic pain and not having answers is having a bigger impact on these people's overall well-being in addition to the care they're seeking. So there's more to come, and there's a lot of sort of complex issues that are all tied into this, for sure.
Wow. Okay. And we're just about to move into some questions from the audience, so if you want to do some typing out there in Instagram land, video land. But what's the reaction to the story? What reaction are you seeing to the story?
I've been very overwhelmed by how many messages I've received, and the overall reaction has just led me to believe that there are more people experiencing this than I ever thought possible. I thought, the 70-something people who filled out the survey was a really large number of people struggling, and I've gotten a lot of emails and messages of people saying, hey, this is affecting me too, I'm still waiting, I'm still without answers. And I think I hope that what comes next is that there's some pressure on our province to really look at this, to take this seriously, to put funds into it, to really think about how gaps in this care are hurting Nova Scotians, and hopefully there's some sort of awareness and pressure to make things better in this regard.
Yeah, that sounds great. Okay. Let's take one from the audience.
Sure.
Okay. This is from Candy Queen 890. Candy Queen writes, I heard they aren't doing many laparoscopy procedures anymore. Do you know if this is true?
That's a hard question. I don't think it's true that they're not doing laparoscopic procedures. I think they are still happening. What the province has acknowledged is that the health department has had to make a lot of pauses throughout the pandemic. So things like laparoscopic procedures were put on the list of things that would have been paused in some of the earlier waves of COVID. So I don't think it's true that they're not happening anymore, but I think your wait time may not be what it used to be, and it really is going to be a case-by-case basis for that.
Okay. We've got a skeptic, or just a careful, someone who's careful. You talk to a lot of people in the story. How do you know the people answering your survey are even real?
That's a great question. Everyone who filled out the survey attached it to an email address. We have names, postal codes, phone numbers, all that sort of thing. And so a lot of the people in the survey I would have reached out to and chatted with and done some, further follow-up. So the survey respondents do feel like real sources, even if we mostly communicated in this electronic way. They are real people with identities and contact info, and people who sharing their stories made this all possible.
Cool. Why did you start with mostly endometriosis and other painful conditions and not fertility?
Oh, that's a great question. I think how the sort of framing of the articles goes has a lot to do with where the sources come from first. And so the endometriosis, painful uterine conditions, things like that, that's where the majority of the people who spoke to me first were what they were experiencing. And then it was from there's sort of this cross-section of people who may have dealt with PCOS or endometriosis, and then are also working on fertility. So I think they kind of lead into each other nicely, and there's definitely some overlap there. Yeah.
That makes sense. Good job. Someone wonders, is the survey still available? Oh, and that's I'm sorry, I'm bad at putting everyone's handles. If I miss your handle, sorry, but that's from meg.co. So meg.co wonders, is the survey still available?
The original survey is available. It's not something that I'm going to be continuing to use as a reporting tool. So my next push is all about fertility. So if you've experienced fertility and want to talk about that, please send me an email and I can get you into the fertility survey. But the original survey has been sort of completed at this stage, and further follow-up would be in some other form later.
Okay. Do you want to say your email address?
Yeah, it's Lyndsay@thecoast.ca, LYNDSAY@thecoast.ca. And if you have any questions at all, you can reach me there.
Cool. Candy Queen has a follow-up. Candy Queen 890 wonders, has the government commented on the story? Has the government commented on the news piece? Has there been any other political reaction?
So the government has not commented on this piece in any regard in terms of the party, which is in government. I haven't heard any response from the premier, from ministers. There has been some reaction and some commentary from, of course, both opposition parties. We've seen some response from the Liberal Party, some response from the NDP, sharing their thoughts on this. And so there definitely has been some political reaction, but no, I've not directly heard from the government at this stage.
Okay. I assume for the next one you'll be trying to talk with the government?
Oh, yes. So the government is, before these stories go out, I give our government I ask them for their comment as sort of the last step before anything goes forward, and I talked to Health Minister Thompson and the Premier for this story, but no, not since that point.
Okay. Please keep doing the story. Can my GP diagnose endometriosis?
That's a complicated question. Essentially, not fully. A lot of family doctors, primary care providers can assess your situation and can maybe tell you that they think endometriosis is what's causing your ailments, but to get a full diagnosis for endometriosis, there's typically a laparoscopic procedure. Sometimes you can diagnose with an MRI. So both of those things require sort of additional referrals on top of your primary care to get a diagnosis.
Whoa. Okay. There's so many. That's a good one. Does Lizzy have a sense of how many people who shared their story with you have issues because they don't have a family doctor?
Oh yeah, so that was something that I asked about in the survey. So I think the number was somewhere around 14%. I think around maybe 10 of the respondents let me know that they did not have a family doctor, and that the way that they accessed care was either through a walk-in clinic, a sexual health clinic, or other ways. One of the individuals who spoke to me had no family doctor at the start and a family doctor later on throughout her experience in getting care and diagnosis. And so it's definitely, yes, much better, much faster care when you have a primary care provider who can spend more time with you. And so there's, sort of a little under 15% of those who chatted with me were dealing with this without access to a family doctor.
Cool.
And just to comment on that, as of February 1st, there are 86,000 Nova Scotians who do not have a family doctor. So that is certainly a big portion of our population who are looking for medical care without that access.
Yeah. Okay. So we'll let everybody go. We're about to let you go. I'll let you go. Just a couple more things. One last question. You talked about the new clinic at the IWK.
Oh, yes.
How do I get into that new clinic?
I'm so sorry that I cannot help you in any way for getting into that clinic. That is something where my understanding, the patients that are seen in that clinic are ones that have had not had luck with first or second line treatments through their original care providers. And then it's a small group, it's 12 people at a time who are sort of already in the gynecological system for seeking care that are selected to join this clinic if they meet the standards. So I don't have an answer for how to get into that.
12 people at a time out of a patient pool that might be 50,000 people.
Yeah, who knows? Yeah.
Well, crisis indeed.
Yes, absolutely.
Okay. Well, thank you, Lyndsay. Thanks for answering our questions. And producer Oriel Salvador from the coast, thank you for keeping track of questions from readers like you. And thank you. Thank you for those questions, and thank you for watching this. Now to recap, to read the story, head to thecoast.ca/endo, E-N-D-O. And to find out when you can read the next parts when the series comes out. There'll be one next week, and then to get first dibs at those, to know exactly when they're coming, sign up for the Coast Daily newsletter. Lovely email newsletter with lots of great tips and information besides your series, but definitely your series in there too. So if you scroll to the very bottom of the story, scroll like this with my finger on the screen. There's a link to sign up for the newsletter at the bottom. You can also sign up for the newsletter by clicking the Support Us button in the navigation menu at thecoast.ca. And if you're financially able, you can also use that Support Us button to help fund coast journalism like Lyndsay has been doing and will be doing in the future. So for the Coast and for Lyndsay Armstrong, I'm Kyle Shaw. Hope you join us next time. And what? Do we hit that live button?
Hit that X.
The X, okay. I'm going to X you out. Thanks again.